Today I am telling about skin tumors in detail. Skin tumors are abnormal growths that originate from various components of the skin such as epidermis, dermis, or adnexal cell structures. They can be classified broadly into benign types and malignant types with diverse clinical appearances and behavior. Classification and types. First one is benign skin tumors. Common benign tumors are warts, which are caused by viruses, seborrheic keratosis, which is scaly or wart-like growth, nevi, moles or birthmarks, dermatofibromas, scar-like growths often from trauma caused by trauma, and lipomas, which are fatty tissue growths. Benign tumors generally grow slowly, may be multiple, and rarely cause harm aside from aesthetic concerns. Some benign tumors may recur if incompletely removed. So, what are the common benign tumors? Warts, seborrheic keratosis, nevi, dermatofibromas, lipomas. Next, coming to malignant skin tumors. These are skin cancers. These originate from uncontrolled growth and can invade surrounding tissues or metastasize. The three main types of skin cancers are basal cell carcinoma, squamous cell carcinoma, and melanoma. So, what is basal cell carcinoma? Basal cell carcinoma is the most common cancer. Skin cancer usually appears as a pearly, flesh colored, or pink bump, often on sun-exposed skin like the face. This grows slowly and rarely spreads but can cause local tissue damage. Next is squamous cell carcinoma. Appearance is often a firm red bump, scaly patch, or an ulcer. It is more aggressive when compared to basal cell carcinoma. Squamous cell carcinoma is more aggressive than basal cell carcinoma with the potential to metastasize, commonly develops on sun-exposed areas. Next, melanoma, the most serious and aggressive type arising from pigment producing melanocytes. It often looks like a mole. It looks like a mole that changes in shape, size, color, and can spread rapidly. Additionally, certain precancerous lesions like actinic keratosis may evolve into squamous cell carcinoma if untreated. So, what are skin cancers, malignant skin cancers? Basal cell carcinoma, which is most common, squamous cell carcinoma, which is more aggressive than basal cell carcinoma, melanoma, which is the most serious and aggressive type arising from pigment producing melanocytes. Certain precancerous lesions like actinic keratosis may evolve into squamous cell carcinoma if untreated. What are the causes and risk factors? Ultraviolet radiation from sunlight or tanning beds is the primary risk factor for most skin cancers. Other factors include genetic predisposition, immunosuppression, and exposure to carcinogens like arsenic. Benign tumors can arise from infection, gland clogging, or trauma, or unknown causes. What is the clinical presentation of benign lesions, malignant lesions, and what are the symptoms? Benign lesions are often small papules, nodules, cystic or keratotic, slow growing, and may be multiple. Malignant tumors are usually solitary, irregular, rapidly growing plaques or nodules that may ulcerate or bleed. Symptoms usually include itching. There may be itching to the patient. There may be pain or non-healing sores which suggest malignancy or infection. Diagnosis and management. How do we diagnose skin cancers and how do we manage them? Diagnosis is primarily by clinical examination and confirmed through histopathological biopsy. Treatment depends upon the tumor type. Benign tumors may only require cosmetic excision or no treatment at all sometimes. Malignant tumors need surgical removal, sometimes supplemented by curettage, electrodesiccation, cryotherapy, radiation, or chemotherapy depending upon the type and stage. Early diagnosis and treatment are critical to prevent metastasis and disfigurement. So, regarding treatment of the various types of skin tumors, for example, benign tumors. What is the appearance? They appear as smooth papules, nodules, or cysts. They are usually slow growing, usually harmless. What is the mode of treatment for benign tumors? Benign tumors, skin tumors. Observation or excision if needed. Next, coming to basal cell carcinoma. Origin of the basal cell carcinoma is from basal epidermis. Appearance is usually pearly flesh or colored or pink bump. Behavior is it is locally invasive, rarely spreads. How do we treat basal cell carcinoma? Through surgical excision and radiation. Next, coming to squamous cell carcinoma. Origin is from keratinocytes. Squamous cell carcinoma originates from keratinocytes. How does it appear? It appears red, scaly patch or firm nodule. How the behavior is? It can metastasize. Squamous cell carcinoma can metastasize. How do we treat squamous cell carcinoma? Sometimes excision, sometimes radiation, and sometimes chemotherapy also. Next, coming to melanoma. Origin is melanocytes. How do they appear? How do melanomas appear? They appear irregular, like a changing mole or spot. Behavior. They are highly aggressive. Metastatizes. How do we treat melanomas? Wide excision, sometimes possible systemic therapy. So in conclusion, skin tumors range from benign growths causing mainly cosmetic issues to malignant cancers that can threaten life. Sun protection, monitoring of skin changes, and prompt evaluation are key to effective management. Thank you. Please do watch, share, subscribe to my channel. Thank you.